Cardiovascular diseases remain a major health threat, where 1 in every 4 adults is a victim, whereas 1.6 million babies born in Uganda annually, 16,000 have heart defects. The Executive Director, Uganda Heart Institute, Dr. John Omagino, attributes this prevalence to sedentary lifestyles and poor eating habits.
Cardiovascular diseases are basically preventable because they are caused by lifestyle changes, where we, as a human being, we fail to balance what we eat with what we burn, because the only way to get nutrition which is necessary for your body is by eating food which must be healthy food. Lifestyle diseases, we are getting these ones through our lifestyle. Man is meant to be active like a fiddle all through life. You must get your food by gathering and not by via the supermarket market.
Dr. Omagino is advocating for policies that government should pass, aimed at reducing the burden of cardiovascular diseases among institutions.
All our institutions where our children are, whether it is nursery, primary, senior secondary, university, training colleges, and all those government, all those public institutions where our children are, nobody should be given a certificate to operate any of those institutions unless he can show space for what? Physical what? Exercise.
The Permanent Secretary, Ministry of Lands, Housing and Urban Development, Dorcus Okalany, represented the Prime Minister and reiterated government's position to support the institute to get its own home and reduce on referrals abroad.
The government of Uganda and His Excellency the President are committed to expanding the Uganda Heart Institute services and improving the access to cardiovascular care for all Ugandans. The signing of the financing agreement for the construction and equipping of the Uganda Heart Institute infrastructure development marks the pivotal moment of our effort.
Cardiovascular diseases can easily be prevented rather than treated. Dr. Henry Mwebesa, the Director General Health Services at the Ministry of Health, advises Ugandans to go for early screening and diagnosis of heart diseases.
As the Ministry of Health, we are emphasizing that we need to prevent these conditions before we develop complications. Stop smoking, stop drugs, but also early going for checkup for early diagnosis and treatment.
Dr. Omagino highlighted on the progress of the construction of the Heart Institute.
The land is all ours. We have the land title, all the encumbrances are solved, and now we are dancing on our what? On our land. The titles and the rest of the things, those ones have been sorted out.
The World Heart Day was set aside to increase public awareness of cardiovascular diseases, including their prevention and global impact. Mary Namkose, Irene Faith Nantongo, UBC News.